Welcome to Phoenix Rising with Dr. Z. This podcast is all about conversations about healing and rising from the ashes of your grief and trauma. I'm your host, Dr. Christina Zampitella. It is my sincere hope that this podcast is going to give you the words and the understanding to help you heal through your grief and trauma. This is Dr. Zampitella with Phoenix Rising with Dr. Z. I am really glad that you are able to join us today. This is a topic that I've been asked to cover quite a bit through multiple requests, both online and via email. And so here we are. We are going to be speaking with Dr. Samantha Sanderson Brown, who I know, I think because she watched one of my presentations, and then we ended up collaborating and are collaborating on some really cool topics of interest of Samantha's and of mine now. She's got me hooked. But with that said, we're going to be actually talking more about her personal experiences of when she was diagnosed, like what her experience was when she was diagnosed with a chronic illness, and then what happened leading up to it, what happened when she was diagnosed, and kind of how that has altered her life since then. And so I am going to introduce you, just ask Samantha to introduce herself, tell us a little bit about your background, and then we'll start talking a little bit about what brought us here today.
Okay, sounds good. I appreciate it. Thank you. Feel a little pressure with all this, suggestions for this topic, but so hopefully I deliver. I appreciate you having me on. Yeah, so my background is I'm a clinical psychologist, but before that I was an athlete, and I should say am an athlete, but I was a soccer player, and I decided to go to school to help other athletes. That was my goal. And over time, that's developed into some different experiences based off of what I've been through and different interests. And so that led me, led me to your grief course for, I think it was a 3-day one we did, maybe it was 2. But just learning about grief and kind of understanding how that fits, kind of seeing that in my clients and things like that. And then as I went through, kind of really recognizing my experience with chronic illness in the content that you were speaking about. And so when we were speaking about maybe me coming on and talking about my experience, of course I got a little bit nervous because it's one of those things I think for me, I have a chronic illness, but you can't see it, which is, for a lot of people, that's the case. And so whenever I disclose it or do talk about it, there is a certain vulnerability that I have to lean into to do it. Which is part of the life-altering piece of having the secret that I carry around with me, depending on the situation. So that's a little bit about myself and my background. I'll say that, while competitive soccer defined my childhood, I am the youngest of 3 girls. So I am the baby, but not a typical spoiled baby. I'm more like, the responsible older sister. And then my parents are fantastic, and we all grew up in Ohio. So that's where I'm from, but I'm in Colorado now because mountains are amazing. So
mountains are amazing. And you are currently in private practice.
Yes.
And your specialization is?
Working with athletes in transition from sport and using grief theory to help me to conceptualize and understand how to work with that population. And so newly integrated into grief formally, but in my experience, now I just have language for what I've been doing, if that makes sense.
It does. And I think that's another one we probably should do, because I would say not just professional athletes, or, I feel like college level is professional, but okay. So college level.
Elite. We use the word elite. Yeah.
Elite. Okay. There's levels.
Tiers, yeah.
There's tiers. So little league.
Yeah.
Then.
And then youth, and then
youth. Keep going.
Club or travel, depending on what area you're in.
What about high school? Is high school in there?
High school's overlaps with club.
Overlaps those two. And then we go to college. Elite. college. So
Elite,
that's
and
elite.
then professional,
And then professional.
or
Okay.
semi-professional, and then professional, depending on where
Good
you are.
freaking Lord, man.
And then
It's
we have
its
our national
own,
teams. It's a whole thing.
it's the whole
Soccer's
thing. And then you got
complicated.
Olympics.
Yes,
Isn't that
exactly.
bigger than internet? Okay, we're totally off topic. That's totally, it's whatever.
It's
But
not.
there is a grieving process there, which is one of the things that we've been
Yeah.
talking about.
And
And
one of the things we find, it doesn't really matter how high you played in
mhm.
terms of level. The grief experience is the same. If it mattered to you, it mattered to you.
Yep. Yeah, we could definitely go down this road. Okay, I'm going to pull myself back because I have all the questions. Um, would you like to disclose what type of chronic illness you have?
Yeah, so I have multiple sclerosis, and I say that carefully because it's hard to say. Yeah, so I have MS, and I was diagnosed in 2017. And so that's when I was 30. So I'm 38 now and have been living with it before that. But ever since knowing, ever since then, I know what I live with versus wondering.
So, can you share with us what made you realize, I think maybe something's wrong here? Like, how old were you when that happened, and what did you recognize?
Yeah, it's a really good question. And so at first, so some background just for context, when I was in school, when I was in undergrad, I played soccer. And in the spring season, I had had a few concussions back to back. And back then, it wasn't that long ago, but in the concussion research world, it was ages ago. That was when concussions were really coming to the forefront and the research wasn't where it is now. And so I ended up ending my soccer career based off of what we knew then, and how my recovery was not going the best. So from there, I kind of always had experienced a lot of just weird internal feelings. I didn't feel like myself, that kind of vague descriptors. And then in 2010, when I was out of school and I was working at a university as a psychometrist, I had really good insurance. So I noticed that I was having some numbness and tingling in my hands and some weird sensations, like trying to write. My fine motor skills were a little bit off, just some subtle kind of changes. And because I had good insurance, I was like, let's check it out and see.
And was it consistent, or was it like relapse, remit? Like, did it go, like
it
sometimes it was okay, other times
it
it
was
wasn't?
pretty like noticeable most of the time,
Okay.
enough for me to be like, I should get this checked out, which isn't like me. I'll go to the doctor when I need to go to the doctor. I don't avoid physicians. Um, and I have the traditional athlete mindset of like,
I
well,
can do
screw
this.
it, suck it up, deal
I'm
with
just
it. You
like
know,
about did it even occur to you at this point that, like, what did you think it could have been?
I had no idea,
Like, zero even
no
guesses?
clue. Yeah,
Like, no, carpal
there,
tunnel, no, it's
no,
not that.
there was
Okay.
no like,
Okay.
and no thought it was related to my concussions or anything like that. Which, by the way, my MS is not related to my concussions, but I didn't even make that connection.
Oh, we need to let everybody know that.
Yes, because I've been
And
asked that. Oh, did you get MS because you had concussions?
I actually was thinking it myself. I really was. I was like,
Yeah.
wow, I didn't realize. Okay.
Yeah, there's no research to support that is a contributing factor at all. The biggest research that we know is, with any autoimmune disorder, there's an activating event, usually like a virus or some sort of illness happens, and
Uh,
then within the body, your own cells they encode one of your cells as if it's like an intruder as part of the virus, and then it perpetuates that fighting off that certain type of whatever cell you have. So in MS, it's the myelin that goes around the neurons of how our nerves.
we're going to describe
Yeah,
myelin. I want to come back to this
yeah,
because the
yeah,
science part of it I'm like totally into,
yeah.
but I want to pick up where I already took you off.
Okay, yeah, yeah.
We'll get there. We take the scenic route,
Yeah,
whatever.
that's fine. Yeah,
So, but put a pin in that because,
yeah,
well, first of all, I love brain and bio stuff, neurobiological stuff. But anyway, you noticed that there was tingling in your hands and your fine motor movements weren't, as sharp. And even before that, you were noticing you weren't feeling quite like yourself, but it was kind of vague. You couldn't really put your finger on it.
Yeah, and that was more concussion related because it
Okay.
was just that's a pretty common experience. And at baseline, I'm an anxious human more than is typical. So that, in retrospect, likely informed why my concussion recovery took such a long time. Was because the concussions exacerbated my anxiety, and then I needed to let my brain heal from that.
Okay.
So I had the numbness and tingling, had some kind of weird stuff going on. And then there must have been something going on in my legs, whether I don't remember if it was weakness or not, but I remember doing testing. So when I went to the doctor said, let's test you for Lyme's disease because I was having some, oh, this is going to bring up memories now. I was having some tiredness as well,
Okay.
or just energy issues. And so they tested me for Lyme disease. That was negative. And so then he said, well, let's do some nerve testing. And I remember I had nerve testing on my legs and my arms. So I must have reported something in my legs or they wouldn't have done it there. And they're really just checking the electrical activity in your nerves and your muscles to make sure that the signals are getting sent as strong as they should be. And so my big motor neuron pathways were fine. And then they wanted me to do a sweat test and something else. And I was 22, 23 something, right? So like I was like, cool, yeah, I'll do that. And then I went and got distracted with other things and I never followed up with them. And then
You didn't go. Now you say you got distracted. Do you think there was part of you that's like, I'm getting scared. I don't want to go down that route? Or was it
I
really
think
like, oh, no, no, like
I
kind of
think it was
minimizing it?
more just like they're not going to find anything.
Mm.
Like they did, I did the big tests is kind of, and now I feel like they're just searching and that doesn't, I'm not really interested in like, I wasn't as invested in finding an answer at that point. I was just kind of like, is it anything you can identify? Nah, okay. Like I have other things to do.
But you still had the symptoms.
Yes.
So you haven't been able to identify it. I'm not going to keep, going after this,
It wasn't
obviously.
getting worse.
It wasn't getting worse. So it
Right.
was stable. So you're like, oh, this just is the way it is now.
Yeah. It was kind of like, okay, well, you just adjust and it's not
So
functionally a huge issue.
it's not functionally an issue. Do you, and I'm going to go back to the question because I asked it and you said no, but I'm still kind of curious. Do you think there is any part of you that's like, okay, everything's fine. And, this is just the way it's going to be. And like that minimization or the maybe not really wanting to continue to track it down?
I mean, maybe it's possible. I just remember feeling satisfied with the answers that I got.
Okay.
Like it was
All right.
kind of like, because then when it was nothing, it was like, well, and then we could do this. But it didn't feel like, when doctors are like, we need you to do this
Yeah.
versus like, we could try that. Like it's just a different feel. And so I got more of a sense that maybe he didn't know what was going on. And so I was just going to have to keep going through all of these tests and then thinking, well, what is it really going to change? Like,
So
it's
two parts there. The doctor wasn't, like, yeah, there's something wrong. We need to track it down and didn't
right,
communicate that to you.
right.
It was like, yeah, maybe something. So he was a little ambivalent.
Hmm.
So that you took on that ambivalence
Right,
there as well. And then not really wanting to go through the whole process of trying to, figure out what that was. Because it felt like, obviously, if he's not worried about it, then I really don't really have that much to worry about. And, this is just where things are going to be now. This is a new normal.
right. And I think, yeah, I was 23, so it was just like,
Yeah.
okay,
You're supposed to be doing other things at 23, not worrying about tingling in your hands.
well,
Okay.
and for context, I had by that point at 23 already experienced the death of a few friends. One of
Mm.
which was cancer related, well, two actually. And so in my mind, it was like, well, if it was really bad, they would catch it. Like that's kind of,
Right.
and if it's not that, then so my reference point was also a little skewed in that direction of
Mm.
severity. So I think I just was like, well, it's not that. So
Right. So this isn't, they're not looking for a terminal illness or
right.
something that could be life threatening. They're looking at, they don't know what they're looking for. And obviously they're not so worried about it. So I guess I don't need to be so worried about it.
Yeah. And
But,
I'll worry about it if it gets worse.
and I'll worry about it if it gets worse. Okay.
Yeah.
All right. So 23 comes and goes. You don't go and get the rest of the
Yeah.
testing. And then what?
And then in 2012, I decided I had gone back to grad school. I had decided to go back to school after 3 years off of school. And because I was working for a neuropsychologist as a psychometrist, and I was like, this is great. This is what I want to do. I'm so interested in this. And then I got to grad school. I was like, just kidding, which is a story for another time. But that's what hooked me. So I was in grad school my first month of school, and I got into a car accident where I was rear-ended by a double tractor semi. And
Oh my God.
I had another concussion, but I didn't lose consciousness. I just lost my vision. Like I was aware of what was happening, but I couldn't see anything.
Oh my God,
Just
that is
briefly.
terrifying. Oh,
Yeah,
I
it
can't
was
imagine.
not fun. I don't
No,
recommend it.
0 stars. Like, yeah.
Yeah, so that was right when I was starting school, and so I had another concussion, went back to the neurologist, and went to a new neurologist because my concussions before were out of state. And so this neurologist was great. You know, he was like, this, yep, you absolutely have a concussion. Here's what you need to do. And he gave me some ideas of how to accommodate in school and really encouraged me not to not go to class, which we know now is absolutely the best thing, is to like keep trying to do normal things instead of
Mhm.
laying around forever and then feeling like crap, because that's what happens. um, and so he was helping with that. And then along the way, I developed a tremor. And I remember being like, that's weird. That shouldn't be happening. So to the
Mhm.
point where I couldn't write legibly because my
Oh,
fine motor skills were so problematic. And so, he diagnosed me with an essential tremor, gave me some medication that was helpful. And then we did some brain scans because we did an MRI. We didn't do an MRI for concussion because that doesn't matter. It doesn't show you anything. So when these new symptoms came up, though, he was like, let's check that out. And I still was having some of that, the numbness and tingling stuff. I mean, that stuff
mhm.
was still in and out. And so I truly believe he believed something was going on, but he said our tests don't show anything. And so what he said to me was, I believe you that something is happening in your body. You may be more in tune with what's going on with your body because of your athletic experience. Just have very like heightened body awareness of what's going on, which I thought was a really kind reframe of my anxiety. um, I'm just going to throw it out there. That's what he was saying. But he said, if anything changes, come back to me, go to a different neuro. Like, I don't care. But if something changes, you need to follow up on this. So that was more of a message of like, hey, the limitations of what we have available now are not allowing me to figure out what's going on. And also, here's when you need to go back to the doctor.
How did that feel when he talked to you about it? Like when he said it that way?
It felt validating actually,
Okay.
because I have been anxious my whole life. A lot of my experiences have been chalked up to being anxious, and I know that's a really common stereotype in medicine for, especially for females, like you're just anxious. And so I worked really hard within myself to think, am I just being anxious and trying to, I've been in therapy for a long time. So even at that point, I'd been in therapy for a while. And I was like, it really doesn't feel anxiety related. I'm sure anxiety makes it worse, right? But like, it doesn't feel like that's where it's coming from. And so we had a lot of talks about, he's like, I mean, the things that you're describing don't necessarily go together, but they don't necessarily not go together. So he did
Mhm.
a really good job of saying, like, I hear what you're saying. It could be your anxiety. That is an option. And also, there's these other options. And so for me, it felt more validating because he was one of the first doctors to kind of really sit with me and be like, oh, this sounds like it's really impacting you.
When
And
you say that he said it could be these other options, did he mention MS?
no, he didn't mention any diagnoses. I
At,
think,
oh, at all?
no, I
Okay.
think it was
It could
so.
be something else.
Yeah, I think he was saying it could be something neurological, could be
Mhm.
something muscular. Like he gave me like the categories, but not any diagnoses.
Okay.
Yeah. And that felt validating to me because it was like, okay, and containing, because it was just like, okay, I'm not making this up. If it is my anxiety, I know how to address that. So I'll focus on what I can control right now, which is managing my anxiety. And then now I have a plan. So if
Mm-hmm.
any new symptoms come up or something kind of irks me, which is kind of how he described it, like if something comes up that kind of irks you, like go back to the doctor. And so that gave me a point of, okay, this is going to be my reference for when I need to worry.
Okay.
Yeah.
So then what happens next?
So I go through grad school and have all the weird things, and I'm stressed and, dealing with what grad school is. And then
Same
I
symptoms, no changes in your
Same
symptoms?
symptoms. Yep,
Okay.
no changes. My tremor would come and go. I did notice that it was a little more like fluctuating, but not day to day. It was just kind of like over time, I'd be like, oh, my tremor isn't as bad. But I still would get really weak hands. Like after a while, I just, my strength would feel like it would kind of leave. And then working out became a little bit harder, but again, stress. So who knows?
Mm-hmm.
And then also at this point, I'm what, 28, 29, and thinking I should be 18, right? So there's also that piece of, am I just,
I'm 52. I still feel that way.
right? So it's like mentally, am I just expecting something that's not
Yeah.
realistic?
Yeah.
But still tracking things. I was still paying attention when to things. And then, so fast forward last year of doctorate school, we do our internship. I get matched at Mount Sinai in New York. And so I'm in the rehab medicine department by
Oh.
all luck of the draw that you could get. And that was a whole thing too. Anyway, but I ended up there. They were fantastic. I loved being there. I worked on the inpatient unit with brain injury and spinal cord injury. And so these were folks recently recovering from an incident or a surgery or a stroke or whatever. And then they would go to long-term care. And so while I was there, I learned a lot about the brain and I learned a lot about different illnesses and different ways the brain can be impacted, how that impacts the body, all that kind of stuff. And I did. I saw a couple of MS patients. I had a Guillain-Barré patient, which was fascinating and terrifying. And, cancer patients, I mean, spinal cord injury, I had the gamut. And so as I'm going through this program, I never had a thought where I was like, oh no, what if I have what my patient, that didn't cross my mind. I was never like, what if I'm like my patients? But one day I was going up the subway steps and I couldn't make it up the stairs. I had to stop. I mean, it was like my legs were on fire and they were heavy, and I just had to stand there and like, what is happening? They just hurt really bad.
Were you scared?
I was more confused than scared because I
Okay.
was like, this has never happened. Like maybe my legs would feel heavy or kind of drained when I'd run, but like going up the steps like this, not like
So you
hard.
weren't like, holy shit, like, oh my God. Like, oh
Mm-mm.
my God, what is wrong? You were more like, what's going on? I would have had a freaking heart attack. Okay.
I was like, this is weird, like
Yeah.
what a weird thing to have happen.
Yeah. Yeah.
Um,
Seriously.
and immediately I didn't do anything. I just was kind of like, okay, well, I'm gonna watch that because I don't know what I
I'll
thought was
keep
gonna
an eye
happen.
on it.
I don't know what I thought was gonna happen.
You can totally had this athlete mentality of just like, I'm just remembering all of, because I did martial arts on and off for about 17 years.
Right.
You just always pushed past.
Hmm.
Like, you can do more. You,
Yeah.
you can do more. Like, and when normally, like now, it's like, no, maybe you shouldn't do 2 hit workouts and, 20 minutes of lifting
Right.
and a yoga class
Why
all at the same
not?
time
Why not?
because it just looked like fun. No, my body doesn't do that anymore. So yeah,
Right.
you just learn to push past it.
Mhm.
So your first doctor was a little bit right.
Yes.
Just totally
Yes.
right.
Yeah,
Okay.
and he was Dave and I had just gotten married. So my husband was in New York with me and he knew of my medical history. We had kind of talked about, stuff I had experienced and whatnot. And so I come home and I'm like, I couldn't make it up the steps today. It was really weird. And he's like,
Mm.
oh, interesting. What do you think's going on? I was like, I have no idea. So we kind of just knew it was a thing, and he said, do you want to go to the doctor? And I was like, oh, not yet. He's like, okay. So didn't go to the doctor yet. And then I
My
started,
ass would have been knocking on the doctor's door at 3 a.m. You're
well,
so courageous. That takes so much courage for you to just be like, patience and all that. And for
so
somebody who struggles with anxiety, like that's so opposite of what I would think.
yeah.
I, That's what a dichotomy you had there. Okay, go ahead.
Yeah, it was. It was. And I would say that part of the reason I didn't go straight to the doctor was because I wanted to build a case for the next doctor. I
Okay.
wanted to make sure I had a lot of information and data because having worked in the hospital system where I was, having been in, a university medical system for a while, and then I also have a nephew with a lot of genetic considerations that needs a lot of medical attention. I knew if I wanted to be taken seriously, I had to make sure I had the evidence and not
Mhm.
just a feeling. And so for better or for worse, that's what I chose. And then I started dropping things. And this had happened before, actually. And in undergrad, it had happened. But my dad has a really long history of dropping things. And so it was just kind of like, oh, you're like your dad. You just like, sometimes you're
Yeah.
holding something and then all of a sudden you're not. And that's just part of it.
Mhm.
But then it was happening more frequently. And we lived at on the fourth floor, and you could walk up, but we also had the luxury of an elevator, which, if you've ever lived in New York, it's a luxury. And so I was taking the elevator more because I was just like, man, I can make it up the steps, but it's just hard. And
Mhm.
so after a few months of this, uh, I talked to one of my supervisors and I said, listen, there's some weird stuff going on that I think you should know about. And I'm not quite sure what to do with it. And at this point, I was on the outpatient rotation. And she said, well, I have, I can help you like find somebody if you want. I say, oh, no, I don't want to like put you out, whatever. So I'm going to go to this doctor. I have an appointment already. And I had made an appointment with this neurologist, and Dave went with me, and I had an MRI, and I remember in the follow up, he's like, so what are your symptoms? I tell him my symptoms, I'm like dropping stuff. I've been getting stairs, some word finding issues, but that's kind of been there, whatever. And he looks at my husband. He goes, is that right? And Dave was
Oh.
like, well, if that's what she says is happening, then that's what's happening.
Ooh.
Yeah.
In that
So
moment, were you like, I'm going to shank this guy? Like, yeah, okay,
I
you're
was like,
pretty cool.
oh, okay, this is what we're doing.
This is
But I
what
will
we're
be
doing.
honest, that's part of the reason I brought him because I was like, I don't know this doctor. I don't know what he's going to be like. And I
Okay.
knew Dave would have my back no matter what. So we go over my MRI, which is just of the brain at that point, and there was a finding. Now, I had had enough MRIs to know I had never had a finding. And he said, well, it's just one hyperintensity, so we'll keep an eye on it. And I said, okay, cool.
What's a hyperintensity?
It's like when you get a brain scan and there's something that illuminates that shouldn't be there.
Okay, gotcha. All right.
And so that was the one finding. And he was like, we'll watch it. And I was like, okay. So we leave, and my husband's like, what was that? I'm like, which part? What do you mean?
Because
Uh,
all the things
I
I'm
was like,
having.
oh, sweetie, this is misogyny in medicine. That's what this
Yes.
is.
Welcome. Oh,
He was like, that was so weird. Like, why
yeah.
would he think I would know? Like, that's a great question.
Yeah. This is when
Um,
you start finding a female neurologist. Like, I have a female epileptologist, female doctor, female OBGYN,
mhm.
female oncologist. Like, I'm not saying there's bad male doctors out there. I'm just saying I've run across too many, and I have yet
Yes.
to run across a misogynistic female doctor.
Yeah.
So,
Yeah. Well,
but I mean, I'm sorry,
ironically,
it's just the truth.
I
That's
mean, that's
just
where I
it.
ended up, right?
Yeah.
So I go
With a
back to my
female. Love
supervisor.
it.
I'm like, because I
Love
told
it.
Dave, I'm like, we're not waiting. That's
Yeah.
like not an option.
Hmm.
So cute, but I'll go somewhere else. So I go back to my supervisor. I'm like, I went, this is what happened. And she was like, oh, they just want to watch it? I'm like, yeah, but I don't want to just watch it. And she said, okay. And this is where MS first came up that I remember. That doesn't mean I wasn't already thinking about it,
At
but
that point, you already were.
I might have been already thinking about it just because of my experience. And I was actually at the time working in the outpatient clinic. There was a client that would come in, and she had very progressed MS, and cognitively was impaired. And so she would just really come hang out with me for an hour a week. And her
Mhm.
caretaker knew we weren't really doing like intensive work or anything, but she enjoyed coming. And so we would just hang out. And so I think at this point, I kind of started to put the pieces together of like, oh, this might be something like MS. And so, because my supervisor said, oh, well, my partner works at Columbia, and I can see if he can figure out a way to help you get into their MS center. And so we did. And so my first appointment was in June, I think. And then I saw a female neurologist who was like, okay, well, let's do all the things. Oh, wait, I got to back up because I always forget this part. Okay. Well, never mind. I'll tell you during the diagnostic process because this is how it actually happened.
Okay. Yeah, no, that's good.
So we go through and I get an MRI of my brain with and without contrast, an MRI of my lumbar, thoracic, and cervical spine with and without contrast. They gave me the option to do that all at once or in spurts. If anybody ever gives you the option, do it in spurts. It sounds like, oh, just rip off the Band-Aid. No, I did that. Don't do that. It was awful.
It was awful. What about it was awful?
I was in the MRI machine for 3.5 hours.
Oh, no.
And you can't move, right? Because they got to get the images.
What if you had to pee? Too damn bad.
You can ask for breaks, but like I was trying to get out of it. My body hurt so bad when I was done just because I was laying on the hard thing, right, in one position.
Oh my God.
So my advice would be don't do that.
Don't do that.
So I did that. And then I saw a neuro-ophthalmologist who did scans and examination of my optic nerve, since that's a common experience in MS, even though at the time I hadn't reported anything like that. And then I did a lumbar puncture.
Oh, those suck.
Yeah, it was so fun.
I've had 11 since I've gotten leukemia. Those things are evil. And
awful.
One of these days I will talk about, another thing I do not recommend. Absolutely terrible. But anyway, so they do a lumbar puncture and terrible. Okay. And then
I did get the headache afterwards. So I had to go to a place where they could do the clot because, there's a leak. It doesn't
We need to talk about that for a second. So when people get a lumbar puncture, they're checking out your cerebral spinal fluid, which is the fluid that goes up and down your spinal cord and around your brain and in the parts inside of the.
Right. And they're checking for inflammatory markers.
Right? Or in some cases,
other stuff. But for me,
right. Absolutely. And so what they do is, this is fun. They go in and they put a big ass needle in you after they've numbed you up and they pull some of that out.
And you can't see any of it that's happening.
You can't see anything that's going on. And they may or may not be using an ultrasound machine when they do it. And if they do use an ultrasound machine, there's no guarantee that they're not going to hit a nerve going in. And just a little side note, they did that. They hit a nerve twice for me. And when you have leukemia, they then put chemo in. So not only did I have the lumbar puncture where they pulled out the cerebral spinal fluid, then they put freaking fire in my body, poison in my body on the nerve that they just, went off. So then you lay down, they're like, oh, you got to lay flat for an hour. And then if they've done something though, where it has not like closed up, where exactly they went into your body inside, then it leaks and you can be left with a massive headache, and they can quote unquote do a procedure, but it's really like, we're just going to kind of seal it up a little bit, but you still are going to suffer this for a long time. So that must have been a really great experience. I can't even now.
It was. And what happened was, so I laid there for a little bit. I didn't have to lay there too long. And then they said, okay, if you develop a headache over the next couple of days, pay attention to that because it could mean that it didn't heal up all the way. And I would say, okay, whatever, fine. I did. I got a massive headache because what happens, right, is when the fluid is leaking out, the pressure in your head is not at equilibrium. And so you're getting a headache from the change in pressure from that leak. And so I went back in, they did a blood patch over the hole where that had to heal as well. And then I ended up doing fine after that, but it was just, a lot of time of not feeling good.
Yeah.
And then I went back and I actually called my mom. So during this time, I'm looking up stuff. I'm figuring out, I see my results. I can tell what's happening. And so I called my mom and I said, hey, I know I've been talking to you guys about what's going on. I'm about to go into the neurologist with the results. And when I call you, my mom has a hard time with accepting what's happening? And so I said, when I call you and tell you that I have multiple sclerosis, don't want you to cry. I want you to wait till I get off the phone. And she said, okay, well, they're probably not going to say that. And I'm like, okay. So we go in and she said, okay, yep, there's now 2 lesions in your brain. And you have a lesion on your cervical spine, which is part of the reason I was having weakness in my arms. And your, oligoclonal bands, which is the inflammatory marker they look at in your spine. It's not specific to MS, but they look at a marker to see if it's above a number. I think it's like 5 or something. And if it's above that number, it indicates there's inflammation in your nervous system. So she said, yep, your numbers are above that. And then she said, have you ever had optic neuritis? I'm like, no. Why would I have optic neuritis, right? Because you can't see very well. There's all this stuff. And then I look at my husband and I'm like, I had optic neuritis. And he's like, yeah,
Yeah.
you did.
Yeah. When you had your car accident.
No.
No.
Actually, no. It was the
Whole
year
different
before.
time where you
Whole
lost your
different
vision.
time.
Okay, let's hear about that.
So, because when we got the optic nerve scan, there was scarring. So they were like, you had optic neuritis at some point. And so what had happened was the year before that, I had an episode where my vision was doubled and it hurt to move my eye around. I was having a hard time seeing. I was in a lot of pain. And I called my old boss and I said, this is what's going on. He's like, well, you need to go to the eye doctor. So I walk into this whatever urgent care. And they're like, you need to go to the hospital. And I was like, okay. So I call my old boss back and he's like, hey, I can get you in. He was at Ohio State. He's like, I can get you in up here. Just come up here. I'm like, okay. I drove. Why did I do that? I drove to Columbus, which is about an hour or so away from where I was, to this doctor's office. And they did an evaluation and told them all my symptoms. And they had diagnosed me with some sort of tendon inflammation above my eye because it hurt when I moved my eye. Now, mind you, I still was having double vision and some of the other stuff, but they gave me a steroid pack, which is what you do for optic neuritis. And so it went away. And so I was like, oh, I just have this weird tendon issue in my eye. And so when she said that, I was like, oh, no, I did have optic neuritis, but it was misdiagnosed as this other thing. And so, which is like kind of annoying because it's like if it would have been caught then, that could have been something else.
Kind of annoying. I mean, I think a lot of people, though, talk about how they're so misdiagnosed, as something is wrong. So many different doctors with so many different backgrounds and training. So that's part of it. The other part is like they're not seeing the whole picture, right? You even said I wanted to wait around until I had like more information, more data, so I can give you a fuller picture. And I am going to say it again, when they're working with women, I mean, the research hands down shows that women are treated way different in medical care than men are, right? Mm-hmm. And so, they cough it up to other things. And here you are, and it's not just us. This happens to men too, obviously. The misdiagnosing as you're kind of like the symptoms are becoming gradual and then they're starting to intensify with like chronic illness. It's like, it's getting worse. It's getting worse. It's getting worse. It's like, and you're getting to the point where then finally the clarity starts to present itself because then more pieces are all coming together. Then they're doing more tests and they're finally starting to take it a little bit more seriously. So here you are, started out with this one person and you were like, 23, who cares? I'm going to go out and party. And then it's just getting progressive, not just at minimum. It gets progressively.
But it's so like subtle at times, right? And then there were these moments that were like, oh, that was like a big change. That's kind of weird.
Right.
But it's almost like maybe in some ways there's that athlete mentality, but I still think some of my anxiety was in the way of me pursuing things a little faster because I was like, well, maybe it's just me, right? Like maybe I'm just not, I'm having a bad day and my anxiety is something weird, or maybe I'm making it up or whatever, right? Like the evidence was also for me, for sure. And so she's like, yep, you have multiple sclerosis. It sounds based on your history like you have had more than one episode, but I had basically the minimum markers to make the diagnosis.
What was that like when you heard that?
That I had MS? it was like it was surreal, right? Because it's like, oh, the thing I was suspecting is actually happening, but it also again was like, yeah, I know. Like I just felt like, duh, thank you for like finally agreeing with there's something going on.
Did you freak out at all though? I mean, so I hear validation, clear, because I know when I used to do psych evals for people, to see if they had learning disabilities or ADHD,
Yeah,
when they would get the results back, they'd be like, thank you so much. Now I understand what's going
right.
on. But then there's also the now, shit, now what?